You know, I mentioned we haven't heard a lot about coronavirus until maybe recently, the last couple days. A lot of people have said, geez, has coronavirus just gone away? Well, no, the answer is no. We've had an uptick in 21 states. Just yesterday, Florida had the most cases in a 24-hour period they've had since day one. Why? What is going on? Well, the man joining us on the line right now, a lot of knowledge when it comes to this stuff. He's with the UNLV School of Public Health, also a member of the governor's medical advisory team. Lucky to have with us Brian Labus, who's joining us right now on the line. Brian, thanks for coming on. How are you?
I'm doing well. How are you?
Doing good, Brian. All right, so let me start with the obvious question. Is this a shocker to you or anybody that we're seeing all these upticks? As I mentioned, 21 states now with rises in the coronavirus cases. My first question, why? And my second question, did we open too early?
Well, the why is a little more straightforward. We are seeing an increase because we have more interaction between people. That's how this disease spreads. We went from everybody staying at home to having different types of interactions in the community that went beyond where we were earlier. People are coming in contact with each other more frequently, and that can lead to disease transmission. We also have people who are a bit fatigued and doing all the different social distancing things that are recommended, and so they may not be taking those steps they need to actually protect themselves. As to did we reopen things too early, well, you can't really make a blanket statement about the entire country because every state closed differently, and sometimes even within states they closed differently, and then they all started reopening in different ways. Some were slow and cautious. Other ones basically just reopened things all at once. And so you really have to evaluate kind of what happened in every single location to see was it a little too early or not.
Fair enough, fair enough. So let's talk a little bit about sports and rallies. And I don't want to make this a political interview, but I have to bring this up. As you know, in Tulsa, Donald Trump is holding a rally, 20,000 people. And they're giving people masks, but they're not making it mandatory to wear a mask. How do you, I guess from your perspective, how could you justify something like that? And don't you think that is dangerous with 20,000 people not practicing social distancing?
I absolutely do. And it doesn't matter what the reason for the gathering is. You bring in 20,000 people, put them indoors in one small place, and have them breathing on each other. That is a perfect way to get disease transmission. It doesn't matter why they're there. The virus doesn't care whether it's a mega church or a political rally or a sporting event. You have a lot of people that could easily spread disease to each other.
Yeah, and I've been pretty consistent on this, Brian, and I've said, I'm on the side of these peaceful protesters, but at the same time, the protesters are not practicing social distancing. I would imagine those at this Trump rally are not going to be practicing social distancing. Brian, to be honest with you, I've been in a bunch of these casinos. Let's just call it for what it is. These people are not practicing social distancing. I mean, I'll see 3 people at a blackjack table, and then I'll go look at a roulette table, and there's like 20 people. And I'm saying to myself, what's the point? I just think there's so much inconsistency. I mean, what would you say to that?
I agree. You're trying to keep people from crowding together. Even if you limit the number that are going to go into a building, there's nothing that's going to keep them from standing together. And so that's a problem. And you saw that the Gaming Control Board is now requiring people at table games wear masks, which makes sense, because you're talking about people that are sitting next to each other for an extended period of time. So that makes sense, but it's very difficult to enforce these things. There are people that just don't want to wear the masks. It's made optional in our casinos, so there is that risk of disease transmission. I think something else to think about with the people going into casinos, you're probably also selecting the people who are least likely to follow the social distancing guidelines. If you're really concerned about coronavirus, if you're scared about getting infected, you are not going down to the Strip. You are not coming to Las Vegas on vacation. So you're selecting the people who are probably least likely to follow all those rules as well, and that's an added challenge.
Yeah, if you're just joining us, we're speaking with Brian Labus with the UNLV School of Public Health, and also, as I mentioned, a member of the governor's medical advisory team. So let me ask you this. What are your biggest concerns here, Brian? I mean, as you know, things are opening up now. I mean, the Strip, for the most part, is open. I mean, I get it. There are a few casinos that are not open. But, you know, you got the Strip open now. All these restaurants are open. This stuff about 20, 30% capacity. I've seen bars. I've been to some of these local gaming bars. They have been jam-packed with people. And then we hear Dr. Fauci and other health experts talking about a second wave being absolutely imminent when we're really not even out of this first wave yet. So can you comment a little bit on that? What are your biggest concerns?
Well, I think we're seeing a lot of people coming together in ways that make it easy to spread this disease. And if that happens, I don't want to think that all the things that we did over the past 3 months were for nothing. If we just kind of put off the inevitable and people started ignoring it, and all of a sudden we see tens of thousands of cases and tens of thousands of deaths, that's obviously something we want to avoid. We've basically worked really hard to get to the point we're at, and I would hate to see us kind of just give up on that because people are sick of wearing masks and sick of staying home. As soon as people start coming in contact with each other more frequently and not taking steps to protect themselves, that risk is there.
Brian, we have 117,000 deaths right now throughout this country, and now we see these new statistics coming out that are saying that by October, it's not out of the realm of possibility that we could have upwards of 200,000 deaths. I mean, what do you make of that statistic?
Well, it's not surprising. It's basically just extrapolating the number from what we've seen. Those 100-plus thousand deaths have occurred really over the last 3 months. So we're talking about over 100,000 deaths in a 3-month period. And so if we take this out where we have an outbreak going on the rest of the year, we can really see a lot of deaths. That'll make it one of the top causes of death in the United States, basically right behind heart disease and cancer. So this is a serious, serious problem. I know people are tired of hearing about it, but just because you're sick of it doesn't mean that it went away.
Let's talk about some of those people that are sick of hearing about it, Brian. I speak to people every day that want to compare this virus to the flu. I get angered when I hear that because I don't think there's any truth to back up. So if somebody talks to you, Brian, and has a conversation with you and says, "Oh, come on, Brian, this is just like the flu. This is no different than the flu. It's slightly more serious than the flu." What is your response to somebody that says something like that?
To me, it's not the same at all. We're talking about a disease that has a higher death rate. In the overall population, it's maybe 3 times the death rate of the flu. But if you look at the oldest people in our society, they have really high death rates from this disease. So that's a serious concern right there. We don't want any deaths. It's impossible to completely stop a disease and stop the deaths, but we're doing our best to keep those numbers as low as possible. The other difference with flu is with flu, we have a vaccine. We have something that people can do to protect themselves. And if you do get sick, we have effective treatments. We don't have those things for coronavirus. We also don't have any in our population because the human experience with this virus goes back to the beginning of the year, and that's it. With flu, it goes back centuries. We know a lot more about flu. We can do more about flu. We know how to handle flu better. And so comparing coronavirus to it really just kind of underestimates how serious this problem is.
So I want to give you some news. Donald Trump did an interview this morning, not to bring him up again, but in that interview he admitted that some of his rally goers this weekend may be infected by the virus, but he said small percentage. Now, can you explain to people if there are just because my understanding is if you just have a few people infected in a large group, so many others can be infected. Can you just talk about that, about how this virus works from the standpoint of if you're in a big crowd, how it spreads?
I think what we're getting at here is the idea of a super spreader. So on average, a person infected with coronavirus will infect about 2.5 other people. That's on average if you look at everybody. But all it takes is one sick person to be in close contact with a bunch of other people who are susceptible, and you could literally have hundreds of people infected. We've seen that happen many times. We saw that in South Korea at a church service where several hundred people were infected. We've seen that in the United States at some of these events. Typically, they've been religious services because you have people in close contact and they're singing and putting a lot of virus out into the air and things like that. Not that there's a particular challenge with religious services or anything like that. It's just people coming together and in close contact. So any of these events can really lead to hundreds and hundreds of infections from a single sick person if that person is not wearing a mask and doing things to stop that spread to other people.
Sure. No, that makes sense. And I hope I'm wrong on this one, but I think some people are going to be infected this weekend in Tulsa. I want to ask you this, and it might be a tough question for you to answer, but I'll try to ask it anyway. I know you're a member of the governor's medical advisory team, and for the record, I give the governor a lot of credit because I think he's done, for the most part, a pretty good job in the handling of this virus. But with that being said, do you feel, Brian, that to an extent the governor was pressured a little bit into opening up these casinos, whether it be the Gaming Commission, whether it be casino owners? Because, excuse me, my sense was that the governor didn't want to open up the casinos as early as he did. Can you give us any insight or sense into that?
Well, I think the idea of the governor not being pressured is kind of absurd. He's getting pressure from all directions from everybody. The public health people were pressuring him to do certain things. The general community, people who lost their jobs, businesses, everybody is pressuring a leader like that to make a decision. And you have to decide what's the appropriate thing for our community, taking all of those factors into account. Gaming is the biggest driver of our economy in Southern Nevada. If we keep it closed for a year, we have a lot of people out of work, and we pretty much destroy Southern Nevada. But if you open it too early, you run the risk of having disease transmission. So trying to find that balance of how much risk is acceptable and balancing all of those different demands on you as the governor is really the challenge of leading a state like this. And I think it's not an easy thing to do. There's no playbook for this. We've never dealt with something like this before. So you take the partial information we have from all these sources and make the best decision you can at the time with the information you have.
I agree, and I think we all could. I don't think I would be and want to be in the governor's position right now. It's a tough job he has. Brian, you do a fantastic.
He's not going to make anybody happy.
No, that's for sure. Well, Brian, I really do appreciate your expertise in answering all these questions. Thank you so much. Great knowledge you have. Love to have you on again sometime. Brian Labus, thank you so much for your time.
Thanks for having me.
Appreciate it. There you go, Brian Labus, not only from the UNLV School of Public Health, but as I mentioned, a member of the governor's medical advisory team as well. And I think he answered all those questions as honestly as he could.
And when he talks about being still in the first wave, not to mention a second wave, Dr. Fauci said football might not even happen this year.
Yeah.
You know, Ian, that would be without people in the stands because some of these players are getting the corona now.
No question.